motor function for cranial nerves. And what I talked about is most of the cranial nerves are bilateral. Okay, they have upper motor neurons that are going to be on both sides of the cortex in the primary motor area. Okay, that's where we left off. And I said the one exception to that is going to be the facial nerve, or cranial nerve number 7. Okay, this is looking at the differential diagnosis of an upper motor neuron lesion, which would be a stroke, versus Bell's palsy, which would be the lower motor neuron lesion. So getting started. Here I'm going to have 3 different sections. Okay, this is going to be the normal presentation. I'll use this one for the stroke presentation, and then the final one will be Bell's palsy, lower motor neuron presentation. So thinking about this will be normal. This will be a stroke or CVA. And the stroke is going to represent the upper motor neuron lesion. And then this is going to be Bell's palsy. And that's going to be the lower motor neuron lesion. Okay. And this oval is representation of a face. And up here we just have the frontal sections through the cortical region in the brainstem. Everybody got it? See where we are? So there are 2 different things as far as innervation of facial muscles by the facial nerve, cranial nerve number 7. There's actually 2 different divisions that we have to consider. The first is the upper face division, and the upper face division is going to be from here up. Okay, and then there's a lower face division. It's going to be from here down. Okay, there's 2 different nuclei that are going to be responsible for those 2 divisions. So when we think about the facial nerve, we talked previously about the facial nerve has a motor nucleus, cranial nerve number 7, the facial nucleus, and we've talked about it having being positioned approximately right here in the pons. Okay, let's just go ahead and say that this is going to be let's make this the upper face division. Okay, and that's nothing more than the facial nucleus. And then just underneath that, it's going to be something about it like so that it's the same nucleus, but it has 2 different divisions to consider. You know, I'm going to make that a different color because that's hard to see. So let's make the bottom kind of a bluish color. And let's say that that's the lower face division. Okay. And again, I'm thinking about this is the cortical region in the brainstem, and I'm just going to draw a midline to see if I can make it a little bit more clear. Again, this is just a frontal section for all 3 of these. So located in the pons, we talked about previously, the facial nucleus is going to be the house the lower motor neurons for the facial nerve. Okay, the facial nucleus has 2 different parts. It has an upper face division and a lower face division. The upper face division is going to be responsible for innervating the upper part of the face. So if I had to draw that here. And the lower face division is going to be responsible for innervating the lower part of the face. When I think about patient presentation, I can draw that over here. Patient presentation, the upper face division is going to be responsible for the eyes. So a normal individual without any injury to either upper or lower motor neurons is going to have nice symmetrical eyes and eyebrows. Okay? And he's also going to have, or they're also going to have, a nice symmetrical smile. Okay, so by looking at the picture, you can see that the upper face division of this nucleus is responsible for innervating the eyes and the eyebrows, and the lower face division innervates the smile, essentially, making it really simple. Got it? All right, now, thinking about what happens, that I can tell you that the upper face division is just like all the other motor cranial nerves that we talked about. Okay, so the upper face division has upper motor neurons that are present bilaterally. Okay, and this upper motor neuron comes down and synapses ipsilaterally on the upper face division. And the contralateral side comes straight down, gets to the level of that cranial nerve nucleus, and then decussates and innervates. So just like all the others, right? So the innervation is present bilaterally. And the lower face division is just a little bit different. The innervation for the upper motor neuron is only present contralaterally. Okay, so this is going to be the lower face division. You have your upper motor neuron present in the primary motor cortex, and that upper motor neuron sends out an axon that travels down, gets to the level of the lower face division nucleus, decussates, and synapses. Okay, so this is a normal presentation. Upper face division, upper motor neuron present bilaterally. Lower face division, upper motor neuron only present contralaterally. Questions about normal? Okay, so let's draw the same thing over here in the middle. Not the face quite yet, but for the upper face division, we have upper motor neurons present bilaterally. Okay. For the lower face division, we have upper motor neurons present only contralaterally. Okay. And we have, here's our nuclei for the upper face division, and here's the nucleus for the lower face division. Same situation. For the upper face division, sends out an axon that travels down to here, synapses ipsilaterally, and then contralaterally, comes all the way down to the level of the nucleus, decussates, and synapses, so you have innervation present bilaterally. For the lower face division, you have the contralateral upper motor neuron sends out axons, decussates when it gets to the level of the nucleus, and there's your innervation. Okay. As I said before, the upper face division is responsible for the eyes and the eyebrows, and the lower face division essentially is responsible for the smile. Nothing new yet. Okay, let's say that there's going to be, in this particular case, it's going to be a stroke, which is the upper motor neuron presentation. So the stroke happens at the level of the cortex, and it happens here. So what should the smiley face look like? What happens to the eyes and the eyebrows? No change. Right, no change at all. No change because even though this side has been wiped out contralaterally, we still have the ipsilateral innervation. So both the right and the left side are going to have a nice, happy looking smiley face with symmetrical eyes and symmetrical eyebrows. Okay, now how about the lower face division? What happens is that the ipsilateral side is going to be normal looking, but you've lost this opposite side, and you're going to have a droopy smile. Okay, the reason why you've lost this side is because you've had a stroke contralaterally. There's only one lower face division, upper motor neuron. Questions? Think about the Bell's palsy presentation. Okay, same setup. You have your upper motor neurons for the upper face division present bilaterally. You have your upper face division cranial nerve nuclei here and here. So upper motor neuron axon comes out, synapses on the upper face division. Also happens contralaterally, comes on down, decussates at the level of the cranial nerve nucleus. And that lower face division, the motor neuron present contralaterally only, sends out an axon that decussates at the level of the cranial nerve nucleus. Okay, and so the lower face division gets the smile, and the upper face division gets the eyes and the eyebrow. Okay, same situation, only this time the lesion's a lower motor neuron lesion, which means that the cranial nerve itself, the nucleus itself, houses the lower motor neuron cell body. So the lower motor neuron cell body, or the axons that it's sending out to innervate the face, the lesion is here. Okay, so it's a lower motor neuron lesion. So in this case, even though there's bilateral upper motor neuron innervation, there's only one upper motor neuron, there's only one upper face division and one lower face division, and they were both wiped out. So patient presentation on this side, everything looks normal. Okay, and same for the upper face division and the lower face division. But since both the upper face division and the lower face division, lower motor neurons were wiped out, the eye is going to be droopy and the smile is going to be droopy. So it's the whole half of the face that's affected. Okay, main difference between a presentation with patient post-stroke and Bell's palsy. Bell's palsy is the lower motor neuron. Bell's palsy is going to have the entire half of the face affected, and a stroke is only going to have the lower half of the face affected, and this is why. Questions? Make sense? All right, let's move on. So this is the facial nerve differential diagnosis. Now we're up to the brainstem contents. Move over to the next handout that I handed out last Wednesday. It looks like this. Again, it's just a frontal section through the cortical region, the brainstem, and here's the cerebellum in the back.